a woman can reduce her risk of developing breast cancer by 4 to 7% per additional year that she breastfeeds. Hey everyone, it's Dr. Jinmee Graham, and today we're talking about a topic which I think is just incredibly awesome, which is the benefits of breastfeeding for the breastfeeding woman. Now, more often than not, we hear about the breastfeeding benefits for the child and less about the benefits that breastfeeding offers to the mother. In this video, we'll look at the physical, mental, and emotional benefits that breastfeeding offers to the breastfeeding woman. Let's jump in, starting with the physical health benefits. So during breastfeeding, the breast tissue undergoes full maturation and development, something that is not fully complete during pregnancy alone. Now, what does this look like? Breast tissue contains undifferentiated mammary stem cells that can be prone to abnormal cell growth and malignant transformation. Now, when a woman breastfeeds, these undifferentiated cells become differentiated, which in turn, of course, reduces the overall level of undifferentiated mammary stem cells present and reduces the risk of those cells becoming cancerous. Now, in addition to this maturation, there are other hormonal changes that overall reduce a woman's risk of developing certain cancers later in life. For example, during breastfeeding, the woman's levels of the hormone estrogen are reduced. And this contributes to a reduced risk of developing certain cancers, such as breast cancer and ovarian cancer, which tend to be sensitive to the hormone estrogen. So when a woman's lifetime exposure to estrogen is reduced, then in turn it reduces the risk of her developing certain cancers as well. Studies from the World Health Organization and others have shown that breastfeeding for at least 6 months, and of course longer, provide significant protective effects for both the child and the mother. The longer a woman breastfeeds, the greater protective effects she experiences. A woman can reduce her risk of developing breast cancer by 4 to 7% per additional year that she breastfeeds. Now, this can, of course, be from breastfeeding one child for an extended period of time or breastfeeding multiple children over the years. Other long-term physical health benefits for the mother include a reduced risk of developing type 2 diabetes, especially in mothers who've had gestational diabetes, a reduced risk of hypertension, cardiovascular disease, and cardiovascular mortality. Breastfeeding also aids postpartum recovery. The hormone oxytocin that's released during breastfeeding helps to contract the uterus back down to its pre-pregnancy size, and this can help reduce postpartum bleeding as well as aiding in recovery and healing overall. Breastfeeding also resets the metabolic adaptations during pregnancy, which can gradually aid in postpartum weight loss and also improve metabolic profiles overall in the woman. Now, in addition to these incredible physical health benefits, breastfeeding also offers numerous mental and emotional benefits to the mother as well. 2 important hormones are released during breastfeeding. These are oxytocin and prolactin. And oxytocin, also known as the love hormone, supports bonding between mother and child and also reduces the levels of stress in the breastfeeding woman. Prolactin has a calming effect and can enhance a mother's mood, and these factors together can reduce anxiety in the mother, produce a sense of calm, and this is especially beneficial in those early demanding months of motherhood. These hormonal changes also contribute to a reduced risk of developing postpartum depression in breastfeeding mothers. Studies have shown that breastfeeding women tend to experience a significantly reduced risk in postpartum depression than mothers who have not breastfed. This in part is due to the circulating levels of oxytocin, but also there's a deep sense of emotional fulfillment and bonding that comes from knowing that you're nourishing your baby. Breastfeeding enhances maternal self-efficacy, and this emotional fulfillment leads to a deep sense of purpose that can have positive effects that last well beyond the postpartum period. So in addition to the risk of depression being reduced in the immediate postpartum period, studies have shown that women who breastfed multiple children or for longer periods of time also experience a reduced risk of depression even later on in their postmenopausal years. So to sum it up, breastfeeding offers incredible benefits physically, such as supporting breast health, reducing the risk of cancer, and aiding in postpartum recovery, as well as other mental emotional benefits, such as reducing the levels of stress, reducing the risk of postpartum depression, and contributing to a deep sense of fulfillment and purpose. All of these factors emphasize the importance of supporting breastfeeding as a key component of postpartum care for women. If you're able to breastfeed and it's the right choice for you, remember that you're giving your mind and body something truly valuable in the process. Now, of course, breastfeeding isn't always easy, so give yourself some grace and reach out and seek support if you need it. The heart of motherhood is truly self-sacrificial, and I hope this provides some comfort in knowing that nature's design truly is intended to support not only your baby, but also yourself in the long run. This is sometimes hard to see in the throes of motherhood and everything that comes along with it, and the new highs and lows, and of course those challenges. Whether you're able to breastfeed for a short amount of time or for longer periods, know that any amount of breastfeeding can provide these benefits for you and your little one. If you learned something new from this video, subscribe for more holistic health content and share this with another breastfeeding mother in your life. I'm Dr. Jinmee Graham, and I'll see you in the next video.